All right, everyone, where am I at with my decision about whether or not to do jaw surgery? Last fall, I consulted with several top jaw surgeons, Dr. Gunson, Dr. Wallin, Dr. Bell, and Dr. Pagnoni, and 6 months later, I've had time to mull over the advice they've all given me, and presently I'm leaning against doing the jaw surgery. Why? Well, it all comes down to the risk to reward ratio for me of doing jaw surgery, or put differently, the cost benefit analysis. What would the reward or the benefit of doing jaw surgery be for me? It would be relieving my headaches. For 20 years now, very often I would go to bed feeling great, and then I would wake up with really nasty, debilitating headaches. And my thought was that those headaches might be related to sleep disordered breathing, or possibly postural issues related to a small airway, or possibly a neuromuscular condition related to my tongue being trapped back in my mouth because my jaws were a little bit too recessed, and by relieving my tongue forward, that would relieve the constant tension and squeeze around the occipital nerves that I think are the root cause of my headaches. Well, I've introduced a change over the past few months that has greatly reduced my headache symptoms, and that is time-restricted eating. By taking my last bite of food sometime before 4 p.m., this sensitivity in my neck seems to be completely evaporated. It's remarkable. There's a lot of new science around circadian rhythm and around the importance not just about the composition of what you eat, but about when you eat it. And although it takes a tremendous amount of discipline to stop eating so early in the day, I have gotten used to it. And although my discipline is not perfect, it's good enough that I've turned the volume of these headaches and their frequency down by 80%. So with just that no-cost intervention, no financial cost that is, of course there's that cost of discipline, I have greatly reduced the potential reward or benefit that I could get from jaw surgery. Now what I'm staring at is the cost or the risk associated with it, and that is gargantuan. So of course there's always the mystery risk of injuring yourself by doing a jaw surgery, nerve damage, difficulty with muscles in the face and your ability to open your mouth and use your face as you normally would because of the tremendous trauma that's involved in jaw surgery. There's the aesthetic risk for me, I think astutely identified by Shui Kai and by Dr. Wallin and really by all of the jaw surgeons that I talk to, which is that I'm already relatively prognathic, and that by punching my jaws forward, there's going to be a fine line between how much is the right amount and how much is going to make me into a dog. And that amount seemed to hover in the 5 to 7 millimeter range, but the sense was that no matter how far forward I go, even if it's minimal, there is going to be some risk involved. And to mitigate that risk, I would probably need to do malar implants, also known as infraorbital implants, implants right in this area, which adds cost, complexity, and risk, additional risk, functional risk to the surgery. So I'm not an ideal candidate for jaw surgery from an aesthetic point of view. Next would be orthodontic fatigue. I would need to do more orthodontics to become ready for surgery. And I've been in orthodontics since 2016, and man, I am burnt out. My last few packages of Invisalign that Dr. Lipkin has given me, I have just been totally non-compliant with it because I can't bear to have any more metal or plastic in my mouth, and the prospect of doing another year of braces or Invisalign, it's just so repulsive to me that I don't think I'm strongly motivated enough anymore to do that, especially now that my symptoms are so well managed with time-restricted eating. The next big factor, and I think this is not discussed enough, is the financial factor. I'm married now, and I have 2 little children, and my family depends on me financially. I have to keep everyone fed, and I have to keep a roof over everyone's head. So the thought of spending $50,000 or $100,000 on a surgery that maybe wouldn't help me at all, maybe would make me worse, and if it did help me, wouldn't stand to solve a huge problem because my headaches are so well managed with time-restricted eating, it just doesn't make sense financially for me. And one other point I want to make about jaw surgery finances. If I knew for sure that the cost of doing jaw surgery would be a one-time payment of the surgeon's fees and the travel and lodging of staying in the vicinity of that surgeon for a couple of weeks to do all my follow-up appointments, if I knew that the financial burden would be constrained to just that one-time thing, that would be one thing. But for me, the cost of doing jaw surgery might extend far beyond surgical fees and travel and lodging. it might also extend to auxiliary stuff that I would have to do in subsequent months or years because of complications related to surgery. For example, as I discussed earlier, I would need to do implants if I were to do jaw surgery in order to make it aesthetically feasible. And if I were to do implants with Dr. Pagnoni, for example, peak implants, well, what if a year or two later they become infected? And now I have to go back to Italy and have him remove them or replace them. There's another 15 grand out of my pocket again. Or what if my teeth are damaged during jaw surgery? I've been in orthodontics for 8 years now and my teeth are not in great shape. What if some of my upper teeth are killed by the trauma of the segmental Lefort that's proposed for me, and I have to do implants on some of my upper front teeth? That's another 7 grand a pop. What if 4 of my upper front teeth die? My 4 upper incisors. That's 4 times 7, that's $30,000 in additional dental fees that I wasn't even expecting. I think this is a really important point that people need to understand, which is that to really do jaw surgery without a lot of financial anxiety, it's not just about putting aside the money for the surgical fees and the initial travel and lodging. It's also about having dry powder in the bank to correct complications or errors that might come up later. Last year, I had a conversation with a doctor who had a jaw surgery and developed issues opening her mouth after the surgery and was then splurging on a specialized myofunctional therapist who was helping release fascia inside of her mouth so that she could regain normal function of her mouth. That's probably not cheap. These are the sorts of things that you have to be prepared for if you're going to go down the jaw surgery route. Dry powder is essential, and I just don't have that right now. So I think for me to really have peace of mind to do a procedure that had such a poor risk to reward ratio, I would really need to be in a much better financial position. This jaw surgery would be a huge stretch for me, and there would be no reserves financially for being able to deal with any complications that might arise. All right, so that's where I'm at with it. I'm leaning against doing surgery for now. We'll see how far I can push this time-restricted eating thing. If it turns out to be the real deal and it pans out over several more months or hopefully forever going forward, then I really don't see myself changing my mind. Time will tell, and I'll keep y'all updated on that. That's it for now. Check y'all soon. Peace out.